Hi, this is Dr. Mrinalini. I'm a plastic and cosmetic surgeon practicing at Aestiva Plastic Surgery Clinic, Sagging. Today, we're going to be talking about a very common and very infrequently discussed problem. Today, we're going to be talking about enlarged breast in women and its treatment in the form of breast reduction surgeries. When we speak of enlarged breast, we have to understand that not only it is a cosmetic problem for the woman, but also it greatly impairs the kind of life she leads. Women having large breast will have symptoms like neck pain, chronic shoulder pain, back pain, difficulty in maintaining hygiene, recurrent infections in the breast crease, and also an inability to perform activities like gymming or workout. So, not only does it reduce the woman's confidence regarding her body shape, but also impairs her quality of life. So, breast reduction surgeries should not be strictly viewed as cosmetic surgeries, but rather as a surgery which can improve the quality of life of the woman. Breast reduction surgeries are performed under general anesthesia and entail a period of hospital stay of 1 to 2 days. The woman is usually fit to return to all her activities by about a week's time. High intensity exercises, weight training, and workouts are to be abstained from for a period of about 6 weeks after the surgery. Also, the woman needs to wear something called compression garments in the form of either customized pressure garments or a sports bra, which will aid in the healing post surgery and also keep the woman comfortable in the post op period. Coming to the most frequent concerns a woman has when she contemplates a breast reduction surgery, whenever a patient comes in for a consult regarding breast reduction, the most frequent queries I get are number one, the effect of the surgery on lactation or breastfeeding. So, the breast reduction does entail removal of significant amounts of breast tissue. However, the uh, ability to breastfeed is never completely absent after such a surgery. Yes, there might be a reduction of about 30 to 40%, but the woman is still able to breastfeed her child post surgery. The second most common concern is whether it causes any changes in nipple sensation. Temporary changes in nipple sensation involving either one nipple or both the nipples are fairly common. However, most of them recover in a period of weeks to months, which varies from patient to patient and also depends upon the extent of reduction and the technique used. However, permanent loss of nipple sensation is a very uncommon phenomenon. The third most common complaint, or in fact, the problem which a woman has when she thinks of this surgery, is of the kind of scars it's going to give. So, depending upon the size of your breast, depending upon the extent of skin which needs to be taken out, which is again determined by the extent of sagging, the scar can be either a vertical scar extending from your nipple areola complex downwards till your breast crease, or it can be a T-shaped scar, which it has a vertical component and a horizontal component along your breast crease. However, these scars usually settle very well with time. And if you look at the overall improvement in the quality of life and the kind of shape which we're able to give the patient post surgery, trust me, the scar is actually a small trade off. Post surgery, we can expect an improvement in the sagging which was previously there. Also, the weight related symptoms like neck pain, shoulder pain, back pain. The patient usually has improvement of all the symptoms as early as 1 week after the surgery. She can also resume gymming and other activities in a period of about 1.5 months to 2 months after the surgery. So, another topic which I would want to discuss is about extent of reduction possible. Some amount of breast tissue, which is again technique based, has to be left intact so that the breast has an adequate blood supply and the nipple sensation is maintained. So, yes, there would be a limitation to the actual extent of breast tissue which the surgeon can remove safely. So, whenever you're contemplating this procedure, you need to have a detailed discussion with your plastic surgeon who will give you an exact picture of the kind of reduction which can be realistically expected. Post-operatively, there's going to be some amount of swelling in your breast, so the final results are going to take something like 3 months to be completely visible. Also, there are going to be changes in the shape of the breast post-surgery, and don't be disheartened if you find the nipple position a little weird or the breast being too perky immediately after surgery. This is all a part of the healing process, and things are going to settle down, give you a better shape, give you a better projection over the coming 1 to 2 months of time. Overall, breast reduction surgery has a very high satisfaction rate. The posture of the patient is improved. She is able to do a lot of activities which probably was not being made possible by the large breasts, say gymming or cycling or even swimming. So, if you actually take all these factors into account, the minimal discomfort, which the patient might encounter during the post-op period of about, I would say, couple of weeks to couple of months, is a very small trade-off. And no woman should actually shy away from discussing this problem of enlarged breast with her family and friends. And I also would want to make you understand that this is not something which the patient needs to live with today's techniques available, with the kind of results we can give. I guess every woman has a right to have a healthy and an active lifestyle. So please don't shy away from discussing this problem with your plastic surgeon and finding a treatment which is tailor-made to you and suits you best. I hope you found this video informative, and if you have any other questions regarding this topic, please drop a comment in the comment box below, or you can call us or email us at the address provided. Thank you so much. Have a nice day.